Many times people will come into the office, particularly women, and they'll be asking, why should I be on bioidentical hormones? I've heard that they either are bad for me, or they don't do anything good, or they're just for sex. Well, it's true. Properly balanced bioidentical hormones, and particularly estrogen, progesterone, and testosterone in women, are very beneficial when it comes to sexual function and performance. They certainly allow for better vaginal lubrication, better sexual stimulation and sensation, and better orgasms. But the story doesn't end there. Truly balanced hormones are a positive health benefit for all women. It's been very clearly shown and very, very strongly supported in the medical literature that balanced estrogen, progesterone, and testosterone has many health benefits, including being protective of heart disease, being protective for Alzheimer's, being protective against osteoporosis, and being protective for a number of different cancers. It's long been thought that, quote, hormones have been bad and cause breast cancer. The fact is, the opposite is the truth. Properly balanced estrogen, progesterone, and testosterone have been shown to be breast protective, particularly testosterone, where there's lots of medical literature showing that testosterone is breast protective. Also, estrogen and progesterone, when properly combined and properly monitored, are breast protective. Progesterone alone is breast protective. In fact, progesterone is used these days by some cancer surgeons as a means to help lower the amount of cancer cells that are encountered during breast surgery for breast cancer. So to say that hormones cause cancer is not the truth in any way. Properly balanced hormones actually lower the risk of many different types of cancers. What about osteoporosis? Well, as women age, estrogen declines. Estrogen has receptors on the bone. Well, you would ask, why does estrogen have receptors on the bone? I thought estrogen was just for sex function and babies and things like that. Well, no, it's actually for bone health as well. When estrogen is low, the bone gets thin, what's called osteoporosis, and women have fractures. And did you know that women over 65, if they have a major fracture, have a 25 to 35% chance of not being alive a year later? So if you ask me, I'd like to have my wife or my mother or my female friends have their estrogen balanced so that they don't get osteoporosis when they get older. How about heart disease? Well, it's very interesting that heart disease for women is lower throughout all stages of life, except for when they go through menopause. But when they go through menopause, the incidence of heart disease skyrockets. Well, why is that? It's been directly tied to the lowering of estrogen in their body. So if we replace estrogen with bioidentical hormones, we can lower the risk of heart disease, and the literature is very clear and does support that estrogen does lower the risk of heart disease when it is applied properly and balanced properly with progesterone. Other things like Alzheimer's. Alzheimer's is tied to lower estrogen. Confusion, disorientation, those things get better. So if you're looking to try to help reduce the risk of significant medical problems as you age, balanced hormones is one way to do it. We're an expert at it at my office, and I'd love to talk to you about it and tell you how bioidentical hormones can help you. So call my office for a consultation today, and we can discuss bioidentical hormones.